Hi everyone, my name is Xochitl Mendez and I'm a respiratory therapist in DHR Health. My job here pretty much is taking care of everyone that has respiratory illnesses like asthma, bronchitis, chronic bronchitis, bronchiectasis, emphysema. Actually, an example of emphysema will be this pair of lungs that we have right here. This is how emphysema is developed by patients or people that smoke, chronic smokers. So the lungs pretty much will turn black, and as you can see, my lungs are being inflated by this machine called a ventilator that I will talk to you about in a little bit. Um, Respiratory therapists work in hospitals, doctors' offices. We also work in places called pulmonary diagnostic laboratories. Some of us work in schools. Some of us become professors for the program that you have to go to become a respiratory therapist. Usually the programs are from 2 to 4 years. Here in the Valley, we have two schools that provide this program, and they're both associate's degrees. And up in Texas, we have bachelor's degrees. But either or, you can work as a respiratory therapist. The only difference is the type of board exam that you take. What else? We are work under the supervision of a doctor, which are pulmonologists or intensivists, or even the hospitalist. And we assess, we give medication, we check for monitoring and control of the development of the illnesses, the disease, and we help with the diagnosis. We do these tests that are called PFTs. We do ABGs, which is our arterial blood gases. We get blood from the artery because there's a difference between artery and veins. Vein blood, it's a little bit darker, and artery blood is, or arterial blood is richer in oxygen, so it's bright red. And what we want to check there is the pH of the blood, the CO2, total hemoglobin, and a whole bunch of values that the doctors want to know to determine how sick or how much improvement you're having. And we also give nebulizer treatments. Some of you have taken these treatments at home, pretty sure. You wear a mask, there's a little bit, you put a little bit of medicine in a little capsule, and then you put the mask and there's mist coming out. And that's usually, a lot of you guys probably say with your younger siblings, or you might have taken it before. And usually you can always see it like during flu season, or you have a little cough, or like if you have an asthma attack, that's when you can see it the most of the time. What I was going to tell you about. So these are the healthy lungs. These are how usually lungs look. These are not real people's lungs. These are pigs' lungs, and these are the lungs that we use to depict our lungs because they're the most similar to human lungs. So actually here, I don't know if you can close up. You can see a little bit spot of that could be either like a little piece of cancer in the lung, that little lump right here, and that probably means that the pig that had these lungs had a little bit of cancer development. And you can see also like a little piece over here on the side. So it's not that he was a smoker or anything, but it just happens that, animals get cancer also. All right, let me talk to you about the ventilator. So this is a ventilator or a mechanical respirator. And you probably have heard about this lately and about my profession lately because we have come out of in the news. Respiratory therapists became very, very famous now with the pandemic that we have, COVID-19. So there are some people out there, some patients out there that become very sick of this illness, and they end up having this machine breathing for them. And what it pretty much does is that it controls all of your breathing. It controls how many breaths per minute do you have, how fast the air goes in. It controls how much oxygen we're giving you, how much air we're actually blowing into your lungs to make them inflate. So you're gonna see the lung inflate whenever you take a breath. healthy lung. And I want you to see the difference in the expansion of the lungs when you have a healthy lung and when you have a smoker's lung. And it has the same amount. I don't know if you can see. They're actually both inflating. This one is actually a little bit covered. Let's see if that works. There you go. And you can see the little lump that I was telling you about, like an abscess. It just came like that. We didn't put it in there. That's not true. So what I'm gonna do is that I'm gonna change some settings. I'm gonna change how many breaths. I'm gonna make the lung breathe faster. So I'm gonna increase this so you guys can see what the machine does. And that's already faster. You can try to see the difference. I can also control how much air we blow into the lung. So I'm gonna decrease how much air we go into the lung, or we're blowing into the lung. And that's less. So I'm gonna increase it so you guys can see the next thing that I'm gonna do. So for example, for these patients that have become like COVID positive, they tend to have very low oxygen levels. So one of the settings that this machine has is called PEEP, which is positive and expiratory pressure. So what it does is that the machine blows air in, and then I'm gonna change the setting, and you're gonna see how the lung stays a little bit open. What it does is that pressure that keeps the lung open opens up this grape-like structures called alveoli. So the alveoli are in charge of oxygenating the body, or what we call exchanging gases. So it gets rid of the CO2, and it transfers the oxygen from the lungs into the whole body. So I'm gonna give this patient, we will give a COVID positive patient a PEEP of 20 to improve the oxygen level in their blood. You see how it stays inflated? That's PEEP right there working. It opened up the lung right there. Like, that's a perfect example of how the lung like popped open, and it increased the transmission of like the transfer of oxygen into the body. I'm gonna take off PEEP so you guys can see the difference. The PEEP is gone. So that's usually, like, we naturally have a PEEP of either 2 to 5 centimeters of pressure of water, but then the machine has the ability of increasing your PEEP, or giving you PEEP of, I think it goes all the way to 50. That's right. That's as much PEEP. I never seen it in the hospital setting like that high of a PEEP setting, but it's as high as it goes, because you have to check for pressure on the heart, because you're keeping the lungs inflated and they're right in front of the heart, or right on the chest cavity. You need to be checking that it's not suppressing the heart itself. So let me show you the PEEP again. So I'm gonna give 25 PEEP, and that's inflated right there. Pressure. Now the machine is alarming because it's checking that, or it's telling me that there's a lot of pressure going on, and it's not used to having that much pressure. So we're just gonna go low. And that's it, back to normal. So pretty much these are the machines that separate or make a difference when it comes to very critical patients that we treat. And I mean, the less critical are the ones that just have to have like a little nebulizer treatment. But if you're in the ICU and you really need something to really help you out, like this is the way to go. This is the machine. Guys, that's it for me. Remember to keep your social distance, wash your hands, and don't forget to wear your mask if you're gonna head out. Thank you.